Warm welcome to all our OrthoTV viewers. This is Dr. Farheen Patel, Assistant Professor, Sancheti Institute College of Physiotherapy. Today we are going to learn something about health and disease. We usually have this notion of positive health, better health, healthy aging, and illness, sickness, disease. Today we're going to learn about what are the different dimensions of this health, how do we define health, and how we define a disease. So that's easier for us to understand further concepts of health and health promotion. Let's look into the definition of health first. WHO defines health as a state of physical, mental, and social well-being. It is the ability to lead a socially and economically productive life, have a positive health. For an operational definition, it can be defined as a condition or quality of a human organism expressing the adequate functioning of the organism in given condition, genetically or environmentally. You must have observed that WHO talks about this physical and mental and social aspect. So let's try and understand what these aspects of health are. The physical health is a healthy organism is capable of allostasis, the maintenance of physiological hemostasis through the changing circumstances. This is particularly related to your physical health, how you are able to maintain your homeostasis in order to survive different environments or circumstances or changes around you. Whereas mental health is the sense of coherence as a factor that contributes to successful capacity to cope, recover from a strong psychological stress and prevent post-traumatic stress disorder or any disorder for that matter. You have to have that mental ability to recover from any kind of affliction. Like if when we are talking in terms of physical health, we talk about how if any virus or any organism, foreign organism enters your body has an immune system which tackles it, and then it will, depending upon your immune system, it will tell you whether you're going to fall ill or sick or not. Similarly, whenever an external stressor is applied, how healthy is your mentality, mental health, that you'll be able to recover from it without having any side effects of the same. Then a strengthened capability to adapt and to manage yourself often improves subjects' well-being and may result in a positive interaction between the mind and the body. For example, patients with chronic fatigue syndrome treated with cognitive behavioral therapy reported positive effects on symptoms and well-being. So this will tell you how your mental health has an effect on your physical well-being also. So let's go ahead and see about the social health. It involves including people's capacity to fulfill their potential and obligations, the ability to manage their life with some degree of independence despite if they have any medical condition, and the ability to participate in social activities, including work. Here it is basically how a human being the social animal it is, be a productive and independent part of the society, how it can be a helping hand towards the society also. Now, this notion of positive health, what is all this about? It's a notion of perfect functioning of the body and the mind. It is a conceptualized health. Biologically, it is the state in which every cell and organ is functioning optimally. Psychologically, it is a state in which the individual feels sense of perfect well-being and control over its environment. Socially, it is a state in which the individual's capacities of participation in the social system are optimal. So, like the WHO has always included physical or biological, psychological, mental, or social well-being. The positive health also includes all these three. Now let's look into the dimensions of our health. Like we said, that the emotional component or the social component is always going to be there. The physical component is always going to be there. The mental component is being divided into two different dimensions of intellectual and emotional. And then obviously your environment is going to play a major role in your health, which is why it is one of the dimensions. And last but not the least, and not definitely the most neglected one, is your spiritual health. These formulate the 6 dimensions of your health. Let's see what is physical dimension. The state of physical health implies the notion of perfect functioning of the body, like we saw in positive health. The signs of physical health is in an individual are a good complexion, clear skin, bright eyes, lustrous hair, of good physical build, who has a good appetite, sound sleep, has regular activities, coordinated. So all the things that you can think of in a physical health will be included in your physical dimension. In mental dimension, it will be the balance between ourselves and the environment around us. It is how we coexist with each other or other species and in the environment in general. The characteristic of a mentally healthy person is he's free from internal conflicts, he's well adjusted in his environment, he searches for his own identity, has a strong sense of self-esteem, he has self-actualization, he has good self-control, and he can face problems and find solutions for them. Social dimension. Social well-being implies in the harmony and integration of an individual within the society. How is he a team player? Quality and quantity of an individual's interpersonal ties will define this. Then we will look into the spiritual dimension. Part of the individual which reaches out to strive for meaning and purpose in life. It includes integrity, principle and ethics, the purpose of life, commitment to a higher being, beliefs or concepts that are not subjected to any explanation. It is not necessary that every person will have this dimension of their health. Some people might completely reject this notion of a higher being, which also needs to be considered. Emotional dimension is obviously your health is always related to your feelings, how you usually express it as I am not feeling well today. So that becomes your part of your emotional dimension. You might, if you're feeling, you feel depressed, that is a feeling related to your mental health. Then there might be feelings related to your social health also, like I do not feel today like going and socializing, or I do not feel like talking to my peers today. All this inevitably is going to have emotional dimension is indirectly related to the other dimensions of your health. And the vocational dimension is part and parcel of our human life. If our vocation is not specifically a job, but it can be how we identify ourselves useful for the society, how we are managing our finances. This all comes under the vocational dimension. Other dimensions of health, which are not the 6 main dimensions or determinants of health, are physiological, cultural, socioeconomical, environmental, educational, nutritional, curative, or preventive dimensions. The determinants of health are biological, behavioral, aging of the population, science and technology, information and communication, gender, equity and social justice, and human rights. For biological, it is associated with the genetic makeup of our body. Some diseases come to you genetically. Behavioral and social-cultural is associated with the cultural background you come with or the culture you live in. The behavioral patterns and lifelong personal habits will be determined from what kind of culture you come from. If I come from or my general lifestyle is sedentary, uh, my behavioral patterns do not define a physical activity, or I come from a culture where physical activity is not promoted, which might lead to obesity for environmental, there is going to be always an internal environment of your own body and external environment where you're going to interact with the physical, biological, and psychological components. An internal environment is going to be the harmonious functioning of your organs and systems within the body. The socio-economical conditions are the economic status, education, what occupation you belong to, how is the political system in your country. This will all define your health. Now, if we have talked about the political side, we also have to look into the health services provided by the government for its people. So, is it personal? Is it from community services? The health services, are they reaching to the community, to the rural areas? Is it socially acceptable? All these factors are very important when you're determining your health or a population's health. Aging being one of the major components which has effects on all of us, all of the population, it is increasing day by day. Gender, both the male and female have different type of demands from their physical, mental, and social health. So it might focus on nutrition, reproductive health, violence, lifestyle, occupation. So both the genders will have different type of requirements regarding the same. Other factors like how is the information dissipation, awareness, communication between the peers, between a doctor and a patient, all this will determine your health. Then let's quickly look into the concepts of disease. A condition in which body health is impaired, a departure from a state of normalcy or health, an alteration in human body interrupting the performance of its function is going to be disease. It can be ecological, which is just a maladjustment of the human organism to the environment, or a sociological, where social phenomena occurring in all the societies and fought in terms of particular cultural force prevalent in the society. It can, one thing can lead to other. That is what basically this diagram wants to represent. Disease is a pathological process leading to physiological or psychological dysfunction. The objective quantity, it can be measured. You will be able to see its signs and symptoms, or it will be seen in your lab tests, investigations. Then only it will be labeled as a disease if it has a diagnosis. Illness is just a feeling and experience of unhealth which is entirely personal, and it can be internal to the patient. Sometimes you feel like you are feverish, but when you check the thermometer, your temperature is not raised. So if, for taking this example ahead, if the temperature increase is shown in the thermometer, it will be defined as disease. But if it's just an internal feeling that you are feeling that you have fever, you are feeling feverish, that will be defined as illness. It is just a subjective state of person who feels aware of not being well. Sickness is an external or public mode of unhealth. It is it can be related to social dysfunction also, but nevertheless, these are the play of the terms. But the main thing that you need to focus on is disease and illness. These are my references, and thank you. Hope you had a good learning experience. Hope you understood the concepts of health and disease and its determinants. Thank you so much. I would also like to take this opportunity to thank our Chief Executive, Mrs. Manisha Sangvi, ma'am, for all her encouragement and providing us with this platform. I would also like to thank Dr. Apurva Shimpi, our principal, for his constant encouragement and support. I would also like uh, to thank our technical team of Physio TV for organizing it in such a smooth way. I would, last but not least, I would like to thank our dear Physio TV viewers without whom this would have not been possible. Thank you once again and see you in next video. Thank you.